Genetic testing works through analyzing, DNA sequencing of specific genes, and what we're doing is we're looking for errors or mistakes in those genes that might make the gene not function appropriately, which could in turn put the patient or individual at risk for certain diseases. These mutations can actually put individuals at risk, much higher risks for cancers as compared to the general population. So in doing genetic testing, it allows us to identify those at-risk individuals and implement earlier screening, preventative strategies, whether it be preventative surgeries or giving them opportunity with what we call chemo prevention, which means giving them medicines that might help reduce their risk of developing certain cancers. What I tell providers is if you have a patient who's concerned because of their family history of cancer, just refer them for evaluation, because they may not be familiar with what the red flags are, but someone like myself could sit down and really break that down with the patient and determine if they meet criteria. The next step is to sit down and review this information with the patient to help communicate what their risks are as it relates to this mutation. So oftentimes we can communicate like a quantifiable risk. So what does it mean for this young woman who might be 30 with the BRCA mutation? Well, typically we're going to go ahead and start their breast screening. We're not going to wait until age 40 or 45, and oftentimes they need more than just the standard of care. Many of them are afraid of the results and what that might mean. So being able to sit with those patients and explain to them that having a mutation doesn't mean you have cancer or will ever develop the cancers. It really gives us opportunity to try to implement, prevention, and risk reduction.